Let me ask you something. How many times did you wake up to urinate last night? Once? Twice? Maybe 3 or 4 times? And when you finally reached the bathroom, did the urine flow begin immediately? Or did you have to stand there and wait? Was the stream weaker than it used to be? Did it stop and start? And after you finished, did you still have the uncomfortable feeling that your bladder had not completely emptied? A lot of men notice these changes gradually. At first, they blame the extra trip to the bathroom on the water they drank before bed. Then they blame age. Then they begin planning their evenings around access to a restroom without ever stopping to ask what their body may actually be telling them. For many men over 50, these symptoms are connected to benign prostatic hyperplasia, commonly called BPH, or an enlarged prostate. And whenever I discuss this with patients, one question comes up almost immediately. Is there anything natural I can eat that might help? The answer is yes, but it needs to be explained honestly. There is one small food that has been studied for its potential to improve urinary symptoms associated with an enlarged prostate. You may already have seen it in trail mixes, breads, or grocery store snack sections. Most people casually group it with nuts, although technically it is a seed. I'm talking about the pumpkin seed. But before you buy a large bag and begin eating handfuls every day, there is something important you need to understand. Pumpkin seeds are not a miracle cure. They have not been proven to make every enlarged prostate physically shrink. They cannot replace a prostate examination, prescribed medication, or necessary medical treatment. What the evidence does suggest is that regular pumpkin seed consumption may help some men experience fewer urinary symptoms associated with BPH. That distinction matters. I'm Dr. Emily Carter, and today I'm going to explain what pumpkin seeds may realistically do for your prostate, what the clinical research actually found, how much was used in the studies, how to include them in your diet sensibly, and why relying on this one food while ignoring certain warning signs could be a serious mistake. Before we begin, subscribe if you want more honest, clinically grounded conversations about men's health without exaggerated promises or unnecessary embarrassment. Let's get into it. First, we need to clarify what an enlarged prostate actually means. The prostate is a small gland located below the bladder. It surrounds part of the urethra, the tube that carries urine out of the body. When a man is young, the prostate is relatively small, but it goes through another period of growth beginning in early adulthood, and that growth can continue as he ages. In some men, the tissue eventually becomes enlarged enough to interfere with the flow of urine through the urethra. This condition is called benign prostatic hyperplasia. The word benign means the enlargement is not cancer. However, that does not mean every urinary symptom should automatically be assumed to be harmless. Similar symptoms can also occur with infections, bladder disorders, prostatitis, and prostate cancer, which is why a proper evaluation matters. NIDDK increasingly common as men age, but prostate size and symptom severity do not always match. One man may have a considerably enlarged prostate with surprisingly few symptoms. Another may have only modest enlargement but experience major difficulty urinating because of the precise way the tissue presses around his urethra. This is why the goal of treatment is not always simply to make the prostate smaller. The practical goal is to protect bladder function, improve urine flow, prevent complications, and help the man sleep and live normally again. NIDDK-on symptoms include a weak urine stream, difficulty starting, stopping, and starting during urination, dribbling afterward, frequent urination, sudden urgency, and waking repeatedly during the night. Some men also feel that their bladder remains partially full after they finish. These changes often develop slowly. That slow development is precisely why men tolerate them for so long. When a symptom worsens by only a small amount each month, it becomes incorporated into the routine. A man may stop taking long drives. He may select the aisle seat at every event. He may avoid drinking water before leaving home. He may wake 4 times every night and begin believing that chronic exhaustion is simply part of getting older. It is not something you should be embarrassed to discuss, and it is not something you should ignore. Now let's talk about the pumpkin seed. Pumpkin seeds have a long history of use as a food, but the relevant question is not whether people have traditionally believed they help the prostate. The relevant question is whether that belief has been tested in men who actually have urinary symptoms. One of the most important studies involved 1,431 men between the ages of 50 and 80 who had lower urinary tract symptoms associated with BPH. The men were assigned to receive whole pumpkin seeds, pumpkin seed extract capsules, or a placebo. The group eating whole pumpkin seeds consumed 5 grams twice per day for a total of approximately 10 grams daily, and the study continued for 12 months. At the end of the study, the whole pumpkin seed group showed a clinically relevant improvement in symptom scores compared with the placebo group. However, the pumpkin seed extract capsules did not produce the same clear advantage over placebo. That finding is interesting because it suggests the complete food may matter differently from an isolated extract. It also shows why we should be careful about assuming that every supplement carrying a picture of a pumpkin is automatically supported by the same evidence. PubMed-Mai's trial compared pumpkin seed oil with tamsulosin, a commonly prescribed medication that relaxes muscles around the prostate and bladder neck to make urination easier. Both groups experienced improvement in symptom scores and quality of life. However, tamsulosin produced greater symptom improvement than pumpkin seed oil. The pumpkin seed oil group experienced fewer reported medication-type side effects, but the study was relatively small and lasted only 3 months. The researchers concluded that pumpkin seed oil may help relieve symptoms, while also emphasizing that further studies are needed. PubMed, what these studies do and do not tell us. They suggest that pumpkin seeds or pumpkin seed oil may help some men experience an improvement in urinary symptoms. They do not establish pumpkin seeds as a replacement for medical treatment. They do not prove that eating one individual seed or even one serving will immediately shrink the prostate. And they do not mean every man with nighttime urination has BPH. The title may bring you here because you want to know which one food can help. The honest answer is that pumpkin seeds are among the more promising foods studied for BPH-related symptoms, but the benefit appears gradual, modest, and variable between men. This is not a 30-minute remedy. It is not something you eat tonight and then sleep uninterrupted until morning. In the larger trial, the men consumed the seeds consistently for 12 months. That tells us something important about nutrition in general. Food-based strategies usually work by supporting the body repeatedly over time. They rarely function like medication taken for an immediate pharmacological effect. So how might pumpkin seeds help? Pumpkin seeds contain plant oils and several naturally occurring compounds that researchers believe may influence pathways involved in urinary and prostate function. However, the precise mechanism responsible for the clinical improvements has not been definitively established. This uncertainty does not mean the findings are worthless. It means we should describe the evidence at the level the evidence actually supports. The strongest statement we can make is that several studies have reported improvement in symptom scores among men consuming pumpkin seed products. While the quality and size of the studies vary and more confirmatory research is needed, PubMed cuss how to use them. The large 12-month trial used 10 grams of whole pumpkin seeds per day, divided into 2 servings. In everyday terms, that is a small measured portion rather than a large handful. You can add unsalted pumpkin seeds to oatmeal, plain yogurt, salads, or vegetables. They can also be eaten by themselves as a snack. I recommend choosing unsalted or lightly salted varieties. Many packaged seed products contain enough sodium that eating them freely may undermine the broader cardiovascular eating pattern we are trying to support, particularly in men who also have high blood pressure. Portion awareness matters as well. Pumpkin seeds are nutrient-dense, but they also contain substantial calories in a relatively small volume. More is not automatically better. Eating several large handfuls every evening is unlikely to produce faster prostate benefits. It may simply add hundreds of unnecessary calories to your day. The goal is consistency, not excess. And please do not assume that pumpkin seed supplements are automatically equivalent to whole seeds. The products sold online vary widely in composition, concentration, and quality. The dose written on the front of a bottle may refer to seed material, oil, extract, or an equivalent amount calculated through a manufacturing formula. Those numbers are not interchangeable. In the largest randomized study, the whole seed group showed the clearer benefit, while the extract capsule group did not significantly outperform placebo on the primary outcome. PubMed, I generally prefer beginning with the food unless a qualified clinician has recommended a specific supplement, but even eating the food should be viewed as one component of a larger prostate health strategy. The men who come into my office are often so focused on finding one supplement or one food that they overlook the habits affecting their symptoms every single day. Consider evening fluid intake. If you drink several glasses of water, tea, or another beverage shortly before bed, your bladder will have more fluid to process during the night regardless of your prostate size. This does not mean you should dehydrate yourself. It means shifting a greater share of your fluid intake earlier in the day and reducing large amounts close to bedtime. Caffeine can also increase urinary urgency and frequency in some people. Coffee, strong tea, cola, and energy drinks may make an already sensitive bladder feel even more demanding. Alcohol can affect both urine production and sleep quality. Reducing caffeine and alcohol, particularly later in the day, may improve symptoms more noticeably than adding any single food while leaving everything else unchanged. IDDK vidi matters too. BPH is more common among men with obesity, type 2 diabetes, cardiovascular disease, and low levels of physical activity. That does not prove that every case is caused by lifestyle. Age and family history remain important factors that you cannot control. But it does mean that protecting metabolic and cardiovascular health is also part of protecting urinary health. Regular walking, resistance training, weight management, and improved blood sugar control will support far more than your prostate. NIDDK may also affect nighttime urination. Diuretics, sometimes called water pills, increase urine production. Certain cold and allergy medicines, including some decongestants and antihistamines, may make urination more difficult in men with BPH. Do not stop any prescribed medication independently. Instead, ask your doctor or pharmacist whether the timing or type of medication could be contributing to your symptoms. NIDDK addressed the misunderstanding that natural treatment and medical treatment must oppose each other. They do not. A man can eat pumpkin seeds, exercise, reduce late evening fluids, and still take medication when medication is appropriate. These are not competing identities. You do not become less health conscious because you need a prescription. You become more health conscious when you use the level of treatment your condition actually requires. For mild symptoms that do not significantly interfere with quality of life, a healthcare professional may recommend watchful waiting with regular monitoring and lifestyle changes. For more bothersome symptoms, several effective medication options are available. Alpha blockers such as tamsulosin relax muscles around the bladder, neck, and prostate, often helping urine flow relatively quickly. 5-alpha reductase inhibitors, such as finasteride or dutasteride, can slow prostate growth and may actually shrink the prostate in appropriately selected men, although they take time to work and may cause side effects. Tadalafil may also be used in certain men, particularly when urinary symptoms and erectile dysfunction occur together. When medication is insufficient or complications develop, minimally invasive procedures or surgery may be considered. NIDDK is something I need every man watching to hear clearly. There are situations in which you should not experiment with dietary changes while waiting to see what happens. If you suddenly cannot urinate at all, seek urgent medical care. If you have blood in your urine, significant pain in the lower abdomen or urinary tract, or painful and urgent urination accompanied by fever and chills, contact a healthcare professional promptly. These can indicate urinary retention, infection, or another condition requiring evaluation. Pumpkin seeds are food. They are not emergency treatment. NIDDK, so arrange an evaluation if your urinary symptoms are steadily worsening, repeatedly interrupting sleep, or changing the way you live. A clinician may review your symptoms, examine the prostate, and use tests such as urinalysis, a PSA blood test, urinary flow assessment, ultrasound, or other investigations depending on your situation. The purpose is not simply to confirm that the prostate is enlarged. It is to determine what is producing the symptoms and whether your bladder, kidneys, or urinary tract are being placed at risk. NIDDK TAMP point is that BPH and prostate cancer are not the same condition. Having BPH does not mean you have cancer. But the two can occur in the same age group, and urinary symptoms alone cannot reliably tell you which condition is present. This is why avoiding medical evaluation out of fear can be more dangerous than the information you're afraid of receiving. Most urinary problems are much easier to manage once the actual cause is understood. Now, I want to speak directly to the man who has already purchased 5 different prostate supplements. You may have seen products containing saw palmetto, selenium, zinc, beta-sitosterol, or complicated combinations of herbs with labels promising normal flow, complete emptying, and uninterrupted sleep. The size of the promise does not tell you the strength of the evidence. Saw palmetto is one of the most heavily marketed prostate ingredients. Yet an updated Cochrane review found that saw palmetto alone provides little to no meaningful benefit for urinary symptoms caused by benign prostate enlargement. That does not mean every man taking it will report no change. It means the overall high-quality evidence does not support the dramatic claims frequently used to sell it. PubMedion applies to Brazil nuts. Brazil nuts are extremely rich in selenium, and even 1 or 2 can substantially raise selenium intake. But raising selenium levels is not the same as treating BPH, and Brazil nuts have not been shown to shrink an enlarged prostate because their selenium content varies considerably. Eating large numbers regularly can expose you to more selenium than you intended. So when you hear that one nut can fix the prostate because it contains selenium, understand that a nutrient's biological importance does not automatically make higher intake therapeutic. PubMed pumpkin seeds are the more responsible food to discuss in this context, not because they are guaranteed to reverse prostate enlargement, but because they have been tested directly in men with BPH-related urinary symptoms. The evidence is still limited, the benefit is not dramatic, but it is more clinically relevant than building a recommendation around a nutrient theory alone. Here's the practical framework I recommend. Begin with a small daily portion of unsalted pumpkin seeds. Use them as a replacement for a less nutritious snack rather than adding them on top of everything you already eat. Give the habit time. At the same time, move most of your fluid intake earlier in the day. Reduce caffeine and alcohol if they trigger urgency. Remain physically active and avoid holding your urine for unnecessarily long periods. Then monitor your actual symptoms. How many times are you waking at night? How long does it take for the stream to begin? Does the stream stop and start? Do you feel empty afterward? Are your symptoms stable, improving, or becoming worse? Do not rely only on a vague impression. Tracking these details for 1 or 2 weeks can give you and your doctor a clearer picture of what is happening. And remember that symptom improvement is more important than winning an argument about whether a food shrunk the prostate. If you're sleeping better, urinating more comfortably, and emptying your bladder effectively, those are meaningful outcomes. If the prostate remains enlarged but causes no significant obstruction or discomfort, your clinician may simply continue monitoring it. If the prostate is only mildly enlarged but symptoms are severe, treatment may still be necessary. The relationship between anatomy and experience is not always as direct as people assume. So, can one nut reduce prostate enlargement? The truthful answer is more nuanced than the title. No single nut has been proven to reliably shrink an enlarged prostate. Pumpkin seeds, technically seeds rather than nuts, have shown potential to improve urinary symptoms in some men with BPH when consumed consistently. They are reasonably easy to include in a healthy diet, and they may be a useful supporting habit, but they are support. They are not a substitute for diagnosis. They are not a replacement for medication when medication is needed, and they should never delay care when warning signs are present. If there is one message I want you to remember, it is this. Prostate health is rarely determined by one food. It is shaped by age, hormones, genetics, metabolic health, physical activity, medication use, bladder habits, and whether you seek help before a manageable problem becomes a serious one. Add the pumpkin seeds, but also pay attention to your body. Reduce the habits that worsen your symptoms, schedule the examination you have been postponing, and stop treating interrupted sleep, urinary urgency, and a weakening stream as inevitable changes you simply have to tolerate. Getting older is normal. Living every day around a bathroom without asking why does not have to be. If this conversation helped you understand the difference between supporting prostate health and falling for a miracle claim, subscribe and share it with another man who may be quietly dealing with the same symptoms. And let me know in the comments, how many times are you currently waking up at night to urinate? I'll see you in the next video.